Hi, Assalamualaikum. My name is Husna Atira binti Sabri and I'm from BA 1195A, and today I will present about the current issues of COVID-19 and its effect to the economy of Malaysia. So the SARS coronavirus causes highly contagious coronavirus illness 2019, COVID-19 SARS-CoV-2 in Wuhan, China, reported the first incidents in December 2019, and the disease spread fast, causing the COVID-19 pandemic. COVID-19 symptoms include high fever, headache, excessive tiredness, trouble breathing, and loss of smell and taste. Symptoms may emerge 1 to 14 days after infection. 1/3 of virus-infected patients shows no symptoms. People got COVID-19 via contaminated air containing virus-carrying droplets and particles. The risk of breathing in these particles is greatest when individuals are close together, but is still possible at wider distances, especially inside buildings. Transmissions can also occur if contaminated fluids are splashed in the eyes, nose, or mouth, or via contaminated surfaces. These people are contagious for 20 days after they stop showing symptoms. Several COVID-19 testing protocols have been developed. The gold standard for diagnosis is detecting the virus nucleic acid from a nasal swab using the real-time reverse transcription polymerase chain reaction (PCR). Other prevention strategies include social or physical separations, quarantining, sufficient ventilation, covering one's mouth when coughing or sneezing, and washing one's hands frequently. People should wear face masks or cover their mouth and noses in public to prevent infection. Malaysia's COVID-19 pandemic is part of a worldwide outbreak SARS-CoV-2, and on March 20, 2022, there were 3,900,000 confirmed cases of COVID-19, 270,000 active cases, and 34,000 deaths, and 53 million tests. Since January 2020, Director General of Health Nur Abdullah has directed the medical reaction and readiness of the outbreak in Malaysia under the Health Ministry of three successive governments led by Mahathir, Mohd, and Ismail Sabri ministries. Since January 2020, he's had his role. On January 25, 2020, Chinese visitors visiting Singapore were confirmed as the first cases in Malaysia. Malaysia had few imported cases until March 2020, and when local clusters appeared, a tabligh Jumaah religious gathering in Sri Petaling, Kuala Lumpur caused a considerable surge in cases locally and in neighbouring nations. By March end, there were over 200 active cases in every state and federal territory. This grew nationwide. The Malaysian government under Prime Minister Mohd ordered a countrywide lockdown on 18 March 2020. The MCO was extended to May 2020, and MCO reduced infections by early May. The government gradually lifted lockdown restrictions, starting with the Conditional Movement Control Order (CMCO) on 4th May 2020, which allows most business sectors to reopen under restrictive SOPs, followed by the Recovery Movement Control Order (RMCO) on 10 June 2020. Due to the imported cases, the government extended the RMCO through the end of the year with the travel restrictions from numerous nations. The COVID-19 pandemic followed the 2020 Sabah state election and third globe outbreaks. To stop the spread, Malaysia imposed CMCO restrictions in most states in 2020. COVID-19's impact to Malaysia's healthcare system led to MCO limitations returning in mid-January 2021 and being extended until March 4, 2021. Yang di-Pertuan Agong issued a statewide state of emergency on 12 January 2021, suspending Parliament and the State Legislative Assembly and handing Mohd emergency powers until 1st August 2021. Due to a fewer new cases by March 2021, the government reduced MCO limits. Sarawak and Kelantan moves to Phase 4 of the National Recovery Plan (NRP) on January 3, 2022, lifting movement restrictions. On April 1st, 2022, Malaysia entered endemic phase and must will no longer be required in public, save in contagious and crowded situations, and all international crossing will reopen. On 1st May 2022, anyone regardless of immunization status can enter public buildings, and only COVID-19 positive or quarantine unvaccinated travelers will be accepted. Travelers who have undergone a full course of vaccinations and recovered from COVID-19 will no longer be tested in Malaysia. All indoor and public events will require masks. The Malaysian government signed deal between November 2020 and January 2021 to acquire COVID-19 vaccination stockpiles. China, AstraZeneca, COVAX, Pfizer, Pharma Berhad, and Duphorma were involved, and a COVID-19 vaccine produced by the Chinese Academy of Medical Sciences was tested in Malaysia in January 2021. Khairy Jamaluddin was named Coordinating Minister of the Immunization Program in February 2021 to speed up the acquisition of COVID-19 vaccination supplies for the country, and the JKJAV was formed. On February 11, the Special Committee on Ensuring Access to COVID-19 Vaccine Supply announced that the native-born nationals and permanent residents of other countries will receive free COVID-19 vaccines. Between February 24, 2021 and February 20, 2022, the government initiated the immunization push. Prime Minister Mohd was the first Malaysian to have the COVID-19 vaccine live on national television. Due to the Malaysia's high immunization coverage, the country began treating the COVID-19 pandemic as an endemic illness in late 2021 of October. During the pandemic, investors liquidated Bursa Malaysia Securities due to the virus predicted economic impact, which will last until June 2020. In Malaysia and other emerging financial markets, Malaysia's economy suffered since China is its main trading partner, and experts fear that a prolonged viral outbreak might harm the country's GDP. Aberdeen Standard Investment of Malaysia forecast the Malaysia's ringgit MYR will decline further because of the local and global pandemic impacting the 2020 Malaysia's political crisis. Malaysia's fourth quarter GDP dropped 3.4% in 2021, according to a report. Malaysia's economy shrank 5.6% in 2020, its worst performance since the 1997 ASEAN financial crisis, and COVID-19 affected small business SME. The MCO stopped non-essential enterprises and stopped the groups from Aberdeen Standard Investment of Malaysia forecast the Malaysia's ringgit MYR will decline further because of the local and global pandemic impacting the 2020 Malaysia's political crisis. Malaysia's fourth quarter GDP dropped 3.4% in 2021, according to a report. Malaysia's economy shrank 5.6% in 2020, its worst performance since the 1997 ASEAN financial crisis, and COVID-19 affected small business SME. The MCO stopped non-essential enterprises and stopped the groups from travelling. 70% of the SMEs reported a 50% drop in 1 week. Online shopping for non-food items rose 53%, and online grocery shopping rose 144%, and online meal delivery rose 30%, and more orders on the first day of the MCO. Malaysia Digital Economic Cooperation predicts e-commerce to grow 20% in 2020. The above trends inform these projections. COVID-19 has harmed banks, small enterprises, and even households. People with less education, formal employment, and lower earnings were more exposed to job and income shocks, according to the study. By June 2021, 58% of adults were working compared to 53% in March 2020. This doesn't guarantee excellent jobs or continuous earning, and people who are worked before the outbreak experienced job disruptions, and 27% of those who stayed employed saw their income got cut. COVID-19's effects are expected to last well after the MCO era ends. For the more complete post-COVID-19 financial aid contingency plan, the banking sector should examine unemployment, interest and inflation rates, as well as short and long-term economic prospects. Pandemics impede loan growth, profitability, provisions and liquidity. Banks may have problems altering their distribution network due to the social distance and compliance functions. During this difficult time, banks provided cash flow support to people who needed it. As part of the agreement between the Malaysian government and Central Bank of Malaysia, all individuals and SMEs who receive a 6-month automatic moratorium or loan of financing repayment starting April 1st, 2020 by BNM. This was done to reduce the pandemic's economic impacts. Borrowers whose finances are still being affected by the pandemic were recently granted a loan moratorium extensions and enhanced repayment flexibility. Individuals who have lost employment and income can request a repayment flexibility to extend the moratorium by 3 months. This request needs lender clearance, and people whose salary have been slashed may request a loan payment decrease for at least 6 months and equivalence to their wage cut. Actually, SMEs with cash flow and loan repayment challenges have 3 repayment options. They can pay only interest for a certain period and extend the loan term to minimize monthly payments and agree to other repayments flexibility. Affected debtors receive updated hire purchase installment schedules under the Hire Purchase Act 1967 without damaging the secret credit records. The government has allowed EPF withdrawals to help Malaysians with financial troubles quickly. EPF said today that members under 55 years old can apply for the special withdrawals from April 1st to April 30 and get payments on April 20. EPF encourages members who want to withdraw their savings to check their balance via iAccount and the iAccount mobile app or EPF kiosk. Maximum withdrawals is 10,000 and minimum is 50 ringgit. Infected Malaysians will receive bantuan khas COVID BKC, and Prime Minister Datuk Seri Ismail Sabri Yaakob said the BKC will be paid in stages, with the first part beginning September 6 and ending September 10. The total amount of cash disbursed to banking institutions pertaining to BKC will be 3.1 billion. BKC helps pandemic survivors. Small medium enterprises also get grant khas Prihatin GKP. GKP is a one-time financial support to eligible SMEs to reduce financial load and increase productions and services. Some business owners use the money to pay utility bills, and some use GKP to fill their internet business or online shop. Malaysian Family Fund (BKM), also known as Bantuan Keluarga Malaysia 2022, Malaysia's PM introduced it. It's targeted financial aid from the government to help low-income people with high living costs, and it is only for B40. B40 refers to the lowest 40% of Malaysians' household income, lower than 4,850 per month. BKM is paid quarterly. First is mainstream and social media. COVID-19 causes fear, concerns, and bewilderment, and inflation figures have warned the public to stay indoors and avoid big crowds. Recently, the media began using hashtag stay home and using the hashtag critical message to stop the spread of COVID-19 can reach all sections of society, according to the media. Second is NGO. Most employers have stopped letting workers work from home, and NGO aid pandemic victims. They have provided food, housing, and money. The NGO supply masks, disinfection chambers, and COVID-19 instructions by the start 2020. Essentials frontliner PPE. Due to the COVID-19, PPE is scarce and scarcity hurt. First responder had NGOs and celebrities teach medical PPE. Modern fashion designers design PPE for Malaysia's daughter, Jong 2020. Inmates have sewed frontline protection gear by Charlie 2020, and volunteers sewed first responder gear. The third one is from government. COVID-19 has caused school closures, and scholars are still fighting COVID-19. UPM makes hand sanitizer and face shields. UTM, and also UMK have collected funds for affected students by Nur Fazina 2020. The last one is self-precautions, and most were at home by New Straits Times 2020. Nations shuns food stores, public transit, and travels to avoid germs and diseases. Mask, frequent and hand washings, and avoiding crowds and other precautions. The virus spreads easily through respiratory ill persons and infected objects and surfaces. The WHO recommends avoiding COVID-19 affected mid symptomatic patients and high risk settings. So that is all the presentations of the causes of COVID-19, the effect of COVID-19 to economy, and the solutions to overcome the COVID-19 impacts to economic measure. So that's all from me. Thank you.